So I want to thank University Hospital Zurich and my dear colleague, Professor Claudia Witt in particular, for your willingness to host this meeting. What an amazing international gathering it is, as we just saw 3 continents represented. And I'm here representing both the University of Maryland School of Medicine, as well as the Institute for Integrative Health, of which I'm founder and president. It's a US-based nonprofit, and it's focused on catalyzing new ideas in healthcare, particularly with the idea to shift our thinking from healthcare to creating health, both at the individual, at the community, and at the population levels. We're going to be discussing and learning from each other over these next 2 days about different models for managing challenging diseases, particularly chronic diseases. And one thing that we all have in common from wherever we come from is that we're facing a rising tide of non-communicable chronic diseases, such as cancer, chronic pain, heart disease, diabetes, and an unfortunate increase in post-traumatic stress disorders. Chronic disease globally, it represents about 75% of the total population has at least one chronic condition. About 50% have 2 or more. It's the #1 cause of death and disability in the United States and accounts for about 75% of healthcare spending in the US, which is about $2 trillion a year. So we're obviously not dealing well with this epidemic, despite the fact that there is excellent research showing that the positive impact of healthy lifestyle behaviors, and this is where I think integrative medicine comes in. So our speakers will be discussing clinical models in integrative medicine, and by integrative medicine, I mean an approach to care that puts the patient in the center. It emphasizes healthy lifestyle behaviors and uses healing methods from both the conventional and the complementary medicine where appropriate and where there is evidence to support this. And I would say that integrative medicine is no longer Cinderella waiting in the wings. There are well-established centers, you'll hear from some of those today, at different institutions around the globe. There are professional organizations promoting research and education, such as the Consortium of Academic Health Centers of Integrative Medicine in North America that has, I think, close to 60 universities involved now. The International Society of Complementary Medicine Research, which is a worldwide organization, and the National Institutes of Health National Center for Complementary Alternative Medicine, and the Cochrane Collaboration, which we've been involved with for many years. It actually has a complementary medicine field for over 20 years now and has a database of over 60,000 randomized controlled trials within that database. So my hope is that we will eventually drop the prefixes, such as integrative part of medicine or complementary part of medicine, and we'll just be talking about good medicine. And I believe the meeting that we're holding today and the working meeting tomorrow will take us a long ways towards that goal. So thank you very much.